Welcome to our cultural presentation on adolescence. Our definition of cultural competent nursing care is the nurse needs to understand their own values and traditions along with the patient's, obtain cultural information through evidence-based practice, and apply that knowledge when caring for a patient in a non-judgmental manner. Dr. Madeline Leininger's theory further explains the importance in promoting health and well-being, or to help people face unfavorable human conditions, illness, or death in a culturally meaningful way.
The objectives of our project are: the learner will be able to apply appropriate communication techniques related to adolescence culture. The learner will identify 3 health risks in adolescent culture. The learner will understand the importance of teamwork when treating adolescents.
Some common communication techniques used when caring for adolescents should be to avoid keeping adolescents waiting. This will help make the adolescent feel equal. Also, schedule appointments at the adolescent's convenience, before or after school, before or after activities, before weekends. Also, greet the adolescent first and shake their hand. This will make the adolescent feel like you're dealing with them and not so much the family. Explain confidentiality policies to the adolescent and family. This will help reassure the adolescent that what they tell you isn't going to directly be told to the family. Focus on positive and avoid lecturing the adolescent, and advocate for them. Criticize the activity and not the adolescent. Minimize note-taking. This can make the adolescent feel like you're writing stuff down and mocking them. Talk in terms that they understand. And also always practice good listening skills. Some health risks that you need to be aware of when taking care of adolescents are substance use and abuse, unplanned pregnancy and sexually transmitted diseases, obesity, depression and suicide, and motor vehicle accidents, including alcohol-related. Some reasons why teamwork is essential when caring for adolescents is because adolescents have a hard time trusting others. With distrust working against the healthcare system, communication is a must. When an adolescent can trust one person, they're only going to trust that one person and not tell everything to the doctor and the nurse and so on. Adolescents typically don't ask the real question, and if they do, it's only going to be to that one person that they do trust. Adolescents tend to lie frequently, and they often feel alone or weird.
The most common nursing diagnosis for the adolescent culture are anxiety, disturbed body image, readiness for enhanced communication, ineffective coping, readiness for enhanced coping, fatigue, delayed growth development, ineffective health maintenance, health-seeking behaviors, risk for injury, knowledge deficit, risk for loneliness, imbalanced nutrition, less or more than body requirements, chronic low self-esteem, self-mutilation, risk for spiritual distress, risk for suicide, risk for other or self-directed violence. And we will be doing a skit that is an example of a situation you might find yourself in as a nurse in a clinical setting.
Holly, you need to get off the phone. The doctor's going to be in here in a minute.
Well, what am I supposed to do? Read stupid magazines?
Well, look, maybe one of them are a good magazine.
Oh, okay. I like those shoes.
Knock, knock, knock. How are you doing today? My name's Molly. How are you doing, Holly?
I'm good. How are you?
Good. Mom, I'm assuming?
Ruth.
Nice to meet you. So what brings you into the clinic today?
I've been having nausea and vomiting.
How long has this been going on?
2 weeks.
Do you guys have any family history? Has she had her appendix out, or?
She had her appendix out. We don't have no family history of stomach disorders.
Have you noticed that it comes up after you eat or certain times during the day?
Probably the first half of the day or so.
Have you been experiencing any fevers or headaches or drowsiness?
headaches and fatigue. But it's,
What about you, Mom? Have you noticed anything different?
Just complaining of a stomach ache, not wanting to go to school.
Okay.
But usually by noon she's feeling a lot better, and then she'll go to school. But in the morning she doesn't want to go to school because she's sick to her stomach.
Okay.
Complains of her headache, head hurting. She's
Alright.
missed a lot of school the last 2 weeks.
Alrighty. Well, how about I'm going to run out and talk to the doctor real quick. And Mom, would you want to sneak outside of the room with me? I just need to ask her a few questions about personal medical history of
Sure.
her family. So I'm going to have her sneak out with me. You
I'll
can
be
just
out
hang
front
out.
if you need me.
Okay. I'm coming back in, Holly.
Alright.
So how are you feeling now?
A little better. It's the afternoon, so.
Yeah. No, I'd just like to explain to you that whatever I'm going to ask you a few questions, and whatever you and I talk about will stay completely confidential. We don't even have to discuss it with your mother or your parents unless you would want me to tell your mother something for you. Otherwise, whatever you discuss with me in this room is going to stay between me and you, okay?
What if she asks questions?
Honestly, I'll give her general answers and tell her, you know, if we need to do any tests or something that you don't want her to know about, we'll just let her know that it's standard protocol to rule anything out. And I will not answer any specific questions about that.
Okay.
So, why don't you tell me about what you like to do for fun?
Well, me and my friends drive around a lot and, I don't know, watch movies.
Yeah.
So.
What are your favorite movies?
I don't know. I like a lot of different things.
Yeah. Do you hang out with a lot of friends? Do you have a lot of male and female friends?
Yeah, pretty evenly, probably more guys than girls. I have a boyfriend, so I kind of spend a lot of time with him and his friends.
Are you and your boyfriend, have you been in a relationship for a long time, or?
About 12 months.
12 months. So it's going good? Everything good with him?
Mm-hmm.
Good. What's his name?
Sam.
Sam. That's a good name. So I would like to know how long, or if you and Sam have been physically active.
Yes.
Okay. And how long has that been going on?
For probably 6 months.
6 months? Do you have any questions about that, or
I don't think so.
have you guys been having protected sex? Do you use any sort of protection?
Yeah, he does, but I don't want to go on birth control. Because I've read about side effects and stuff. So.
What side effects are you worried about?
Like weight gain and like stuff like that. I don't want to gain weight.
Yeah, that is one of the side effects, but if you wanted to talk about that more, there are sorts of different kind of birth control that we could try, and then we could see, you know, if you have side effects like that.
Okay.
How has your menstrual cycle been? Have you been regular?
Yeah, but I missed it like 3 weeks ago. But I didn't know if that's just because I've been really stressed lately, so I didn't really think anything of it until I started feeling kind of sick.
So you're about 3 weeks late. Do you think there's any chance that you might be pregnant? Have you had any? Does Sam use condoms? Has he noticed that one is broke, or?
Not that I know of.
So you've been noticing it more in the morning, like when you get up right away, and it lasts till about noon?
Morning sickness.
Well, that's what I'm kind of leaning towards. I just want to make sure that we know, because, you know, the sooner we know, the better we can make sure you're protected and healthy with if you are pregnant. And it's okay if you are. We'll just make sure we we'll do the lab test probably with the doctor, and I would recommend probably talking to your mom about it if it does come back positive, but it's completely up to you. You're the one who's going to be telling them, unless you would like me to be in the room when you talk to her. But this is between you and I and the doctor. So I'm going to run out, and I'm going to talk to the doctor because he's the one that has to order the tests. And we're going to do a urine sample, and we're going to do a blood sample just to rule everything out, okay? So I'm going to go out and talk to the doctor, and you want me to send your mom back in, or should I just have her wait in the waiting room?
She can wait in the waiting room.
Okay, that's absolutely perfect. All right. Well, thank you for letting me know, Holly. Okay, Holly, I'm back in. I did talk to the doctor, and he does want to order those tests just so we can, find out if you are pregnant, or he's also going to do some other tests just to rule out any infections that could be causing stomach pain. Okay. And also with your age group, it's a protocol that they do STD tests. So it's nothing about you. Whenever anybody your age is in here and we need to have stomach pains or any complaints that you're complaining of, we just do a standard test. So it's something we do for everybody your age.
I'm sorry.
It's okay. It's okay.
This is just really weird.
So I'm going to give you this lab slip, and I'm going to walk you out to where your mom is, and if she asks any questions, I'll just explain to her that it's standard protocol. Okay? All right. Thank you for coming in, and I'll see you soon.
Okay.
In the skit that you just saw, the patient was a 15-year-old female complaining of nausea and vomiting. Her mother believed that she was possibly pregnant, but the teen assured her mother that she was not. Some communication techniques that were used in this skit were that the adolescent was greeted first, confidentiality was explained, and the nurse practiced good listening skills. Some nursing diagnoses that would be used for this particular skit would be interrupted family processes, social isolation, knowledge deficit regarding pregnancy needs, expectations, and risk for impaired pregnancy.